The male prostate is a gland the size of a walnut. It's located in front of the rectum, just below the bladder. The urethra, which carries urine from the bladder through the penis, runs right through the prostate gland. And when men ejaculate during sex, it's the prostate gland that creates the seminal fluid.
Prostate cancer is much more frequent in the black population than it is in the white population.
Doctors don't really know why. It could be because of genetics, or maybe the way we eat. The only thing doctors know for sure is that African American men are dying from prostate cancer at an alarming rate. Some because of their attitudes, others because of what they don't know.
What you don't know might kill you as far as prostate cancer is concerned.
Many men don't know what the prostate is and what the function is.
My brother was diagnosed shortly before I was, and he elected to do nothing until after I had my surgery and came out of it okay. And then when he went back, then his had spread, and he eventually passed away.
The major excuse is they didn't have time, they didn't realize it was a problem, they weren't having any symptoms. You may not have any symptoms. It may not cause you to have bleeding. It may not cause you to have pain until it's fairly advanced.
Especially among African American men who tend to be kind of stubborn, and especially when it comes to issues of their health, I guess the machoism comes out and they don't want to seem vulnerable.
Most of the fellas don't want you to get a digital because they said that's unmanly, having somebody to put their hand up there behind.
If the alternative is death in not taking care of a problem that you could have taken care of early, there are pretty feeble excuses.
If you're experiencing frequent urination, especially at night, inability to urinate, trouble starting or holding back your urine, a weak or interrupted flow of urine, painful or burning urination, blood in the urine or semen, painful ejaculation, or frequent pain of the lower back, hips, or upper thighs, you could have prostate cancer. Problem is, by the time you experience these symptoms, it could be too late to save your life.
My father was only 57 years old. He was getting ready to turn 58 years old when he passed. Up to that point in time in his life, no health problems. He was not a smoker, he was not a drinker, but he had one of the rarest and the most aggressive forms of prostate cancer. And by September of 2004, the following year, he lost his battle with prostate cancer. Never thought that anything like that would affect our family, because up to that point, no one in our family had had cancer before.
Doctors say there's only one way to survive prostate cancer: detect it early and treat it right away. Anyone over 40 should have a yearly exam and a PSA blood test, even if they feel great.
Painless. Just a quick little 2 minutes, and it's nothing.
But many men wait too long. One of the biggest excuses used by procrastinators who die of prostate cancer is fear that after treatment, they won't be able to perform sexually.
They don't want the concept of impotence to come into the picture at all, because they feel that they will be losing their manhood.
The earlier you detect prostate cancer, the more minimal the invasive procedures to cure the cancer will have to be. And there are operations now that can be done for early prostate cancer that can spare the nerves so that the prostate cancer can be removed and cured without damaging sexual function to any significant degree.
Too many African American men are dying because no one, not even a friend or loved one, is warning them about prostate cancer.
I did have an uncle who had prostate cancer, but we didn't discuss it.
When Pastor Smith informed his church he had the disease, what happened next shocked everyone.
We came to find out and discover that the majority of the male population of our church, and I would even go as far as saying over 50%, had in some form or were currently at that time dealing with some form of prostate cancer or prostate disease. I wish to some degree now, looking in retrospect, that more men had spoken up about it beforehand. Because I feel that if we knew how severe it was within even our small church population, that could have encouraged maybe not just my father, but other men of the church to be screened earlier or to be screened more regular than normal to make sure that whatever signs of prostate cancer or malignancy were caught at an early enough time.
We want the term to be out there so often until people are more comfortable, such as breast cancer. I mean, it's something that women don't like to talk about, but you see it on TV, you read about it, you hear about it, and so men must come to a realization that we also have something that has taken many of our brothers and fathers and loved ones away from here.
My wife wanted me to tell you that everything is working. Hey, and I thank God for that. You better believe it. It's just beautiful to see so many young men in the audience, and that's those you the guys I really want to talk to. I mean, you know, not that I don't want to talk to you old guys, you know, but the young men, you don't have to go through a lot of this stuff. Okay? Early detection. Go have a checkup. Check on your PSA. Find out what it is that you need to do to prevent this.
Prostate cancer is affecting the health of African American men disproportionately, and the church must speak out. So it's absolutely important for the life and witness of the church and the black family that the pastors will take up the charge and help lead in this fight. The black church is still a strong institution for African American women, and we're finding out how much prostate cancer affects the whole family, affects women. So if we can talk about it, if there are not so many men to hear the cry, we hope that the women will hear the cry, and that they will turn to their husbands, their significant others, and their sons, and say, look, you need to go be screened, go be tested.
The number of men that I see who are directed or prodded by their wives to come in and be examined and seen is a very significant number.
You should have a PSA and a digital, and you decide for whatever reason that you're not doing this, then you are hurting not only yourself, but you're also hurting your family and your friends, the loved ones that you have, who will really be hurt if you're discovered to have prostate cancer later on and it's progressive, and you could have saved yourself and saved your family the anguish of your being diagnosed with something that is going to take you on away from here. Early detection might save your life.